Well, hi guys. I'm Dr. Darren Vanscoy, and this is Lori
Hey,
Wendell,
Lori.
nurse practitioner, back for another podcast with Total Health Pros, Ascend Elite Health. Going to be discussing today some just things that what got us into where we're at and what we're doing, why we're doing, and some issues with testosterone replacement that we've come across in our practice, with issues with patients, and just things that we've seen. So it's going to be like no specific topic today per se, but just overall about why you should seek out hormonal balancing, why you should look for a provider that can help you with the issues that we address and how it can benefit your life. So, Lori, why don't you give a little bit of background on yourself a little bit? We've never really done that on a podcast before.
We probably haven't. We seem like we say the same things all the time because we're just talking to patients every single day. Background with me is I'm a nurse practitioner, obviously. I've been practicing as a nurse since 1985, which puts me at 60 years old. I've been a nurse practitioner for over 15 years. Most of that time I spent in cardiology, electrophysiology. So I call myself a plumber and an electrician of the heart. That's come in handy with our
Very much
practice.
so. Yeah,
a lot
absolutely.
of times we've found things that someone else wouldn't have found because they were just there for a wellness check. But I basically did primary care for a year when I first got out of school. And the provider I worked for, when I would send her my charts, because when you first become a nurse practitioner, you're not independent. Now, I am currently independent in West Virginia since I've been practicing 3 years into my career. But I would send her my charts, and she's like, wow, I can't believe you're stepping out of the box. And my answer to her was at that time was, but why do I want to just treat something because of a symptom? I want to know why they're having that symptom. That's just always been my mindset. But then I left primary care, went back into cardiology.
Yeah.
And practiced in that focused field for such a long time. And then when Darren and I got together, that brain that I have just opened wide again to go back into looking at that, putting the puzzle together, figuring out what's going on with the patient. So in our current practice, and we're going to explain more about that, we look at the primary patient. We'll look at that, but we're also looking at hormones, thyroid included, estrogen and testosterone for women, because we need that as well.
Absolutely. Very underserved.
Yes, just metabolic disorders. And that is so prominent now. And we'll go into, I'm sure, that into detail. Because in 1950 or 1940s, your cookies had flour, sugar.
Basic ingredients.
Basic ingredients. You look at the ingredients now, there's at least 25 or 30.
Plus how many chemicals?
And chemicals. So
Because
those
it's cheaper.
are causing a metabolic disorder that everyone has. That's what's wrong with our basically our children that are actually eating only that food.
Foods are more chemicals than they are actual real food anymore.
So we're seeing a lot of that processed food cause a lot of problems in the metabolic side of the patient.
Absolutely.
So we're really digging into that. So that's kind of a little bit of explanation about me.
Yeah, and so for me, I've been in practice almost close to 26 years now, so it's been a while. So I started out my practice, kind of been in this train of thought line of practice for a while. Really, when I opened my initial practice, I came out of school, opened a practice with 2 DOs, 3 or 4 PTs, a bunch of massage therapists. Basically been practicing functional medicine throughout my entire career. Very nutritionally based, peptide based, trying to hormonally balance patients naturally, really until we got into Lori and I being partners, really wasn't able to do it with pharmaceutics, testosterone, hormones, those types of things. So it's really opened up the practice for me and how I like to practice. How I originally got really into actual real functional medicine was my wife for years had issues with fatigue, all kinds of things that were typical for a thyroid patient. But yet every time we got blood work done, labs done, the docs would say, well, it's within normal range. But, she still didn't feel good. Right, so there's a difference in this is what your labs say and this is how you feel, right? There's a massive difference there. The problem with traditional allopathic medicine, the way medicine, it's just very regimented. If it's in a normal range, you're good, right? And that really isn't the case at all, right? And so we just don't look at labs. We look at labs, but we really look at okay, how does the patient feel? Right. What is going on in your life? What's a deficit? What are you lacking? What are you missing because of how you feel? And so, my wife was constantly tired. She wasn't sleeping well. And with those things, obviously, you get cranky, right? And so, and not that she's a redhead or anything like that to do with it, but, I'm going to be so dead when she watches this. But,
and it was National Redhead Day the other day. I said
yeah, completely so, yeah. So, but, regardless, she did have all these issues and no one would treat it. So finally I went to the doctor that worked for me, and I was like, I sat down with him and I said, listen, could this be an issue? Could she be one of these people that, she's outside the scope of what a normal range is? And he's like, yeah, she could be. And so we started doing testing, looking at some more things. I sat down with him. We really kind of racked our brains together. And really, once we started her treating her thyroid, it was a night and day difference for her. So even though her labs were in the normal range, they were all low normal. And then once we got her to mid to higher functional range, it was a night and day difference in how she felt. It literally changed her life, really changed our relationship within our marriage, changed her activity level, changed her outlook, changed how she slept. It was huge, right? And with 4 little kids at that point in time, that was massive. It was a massive paradigm shift, massive change in our life. So that's really what got me into functional medicine and looking, okay, what are normal values compared to what are functional values? And that's really, really what was the start for me, and just something that's really just been so important in my life and how I treat patients and how we look at patients was really, okay, let's see how they really feel. We'll look at metrics as a baseline and use those as a safety protocol, right? So that we're not too high or too low, but really look at the patient and treat the patient, treat the symptoms, not treat by what the labs say. And that's what we've really incorporated into our practice now. And that's how we practice completely, is when you come in and you have a complaint, we're going to listen to your complaint, right? And so, because talking about testosterone, over and over again, both for men and women, we see patients coming in and their testosterone, or it's a low normal level, but yet they've got deficits in their life, right? How many times do we see this on a weekly?
It's every day, actually, and it's that situation where, as we spoke of, again, optimization of that patient's health, how they feel, and their labs. We look at that as a guideline, like you say, but they're looked at and they're told, well, you're in normal range, because most of the times you get that lab that has the green area, and as long as that little pointer is in that green area, you're normal.
You're normal.
That's not
even though you don't feel normal. Yeah,
absolutely. So it's like everything. It's individualized. You may feel great at a lower than what we think is great testosterone level, but if that's where you've reached and you feel great,
and you feel good,
that's your level.
Yeah,
that's where you should be, and we treat you as such.
So every patient really is an individual patient. We don't have a set protocol. We don't have a set lab. There is no cookie cutter. There's nothing that's just regimented in our practice, right? Every patient comes in, we look at as a different patient. There is no protocol per se. We look and see what's going on with them, and then we kind of proceed from there. You want to kind of outline maybe procedures for a new patient coming in and how we go through that?
Yeah, basically when a patient comes the first time, I'll be honest with you, and my clients really like that. I'm saying, look, I've looked at your history information you sent me. The first 20 minutes, that patient and I are talking about our life.
Getting to know them.
To know them, establishing a relationship. They talk about, I said, tell me about you, and then I'll tell you about me. And then I go through all the things about me. And that's really nice, because they can see, oh my gosh, this person, she's had that problem with her hormones. And, she's got a thyroid problem, and she found all these things herself, and she's treated herself literally, and she's in a better place. So I do that at first. We both do that, get to know the person. And then we go through the history of that patient and look at what's going on, look at their family history, what's going on with them.
It's hugely important.
Yeah, absolutely.
Yes.
Look and their medications they're currently taking, because some of those, example will be Nexium or pantoprazole, something for GERD that they've been on for 20 years, and that's supposed to be a very small amount of time you take those medications. And then we make a decision. Those things usually come a little later, because initially when we get them and decide what lab work we want to draw on them, that's when we make that decision, after we've done all that history and their diagonal history of symptoms, because they've been complaining most of the time for years for what's been going on, like you say, fatigue.
Yeah, and a lot of times they're on medications causing problems, and they're on medications to counteract
that problem.
And no one's really addressed the base issue. Yeah,
and something as small as vitamin D, which at 99% of our patients that we see are extremely low on, or they're in the very low normal range. Our body is dependent on vitamin D for so many things, and vital, as well as magnesium. And serum magnesium, which is just your blood level, is not going to give you that picture. You have to look at a cellular level, which is what we do. So all those things come into play. We look at the metabolic side, as well as hormones and overall function, cholesterol. A big lab panel is ordered. And if you have a family history of heart disease, especially young heart disease,
absolutely,
we're going to look at an extended lipid
cardiac
profile.
Yeah.
If you have problems with diabetes in your family and you have a history of a high blood sugar, you've been told that, we're going to run an extended level there for your sugar, blood sugar, and so forth.
And insulin levels, yeah.
Insulin level, fasting insulin,
Yep.
which is huge. No one usually checks that. So that's a huge underlying problem that then you all of a sudden you have diabetes and you've had a fasting insulin that's been elevated for years and no one ever checked it.
Right.
That's the whole thing. So, and that's a whole lot of information to spit out about the labs, but basically is that we spend an hour with the patient, getting to know them, all the things we've mentioned, and then at that point in time we leave, hey, you have any questions for us? Leave that open-ended question at the end because there might be something, oh, by the way, I forgot to tell you I had this done. You've got to get
Happens
all
all
that.
the time.
Happens all the time.
Absolutely.
Had a lady today said, oh my gosh, I did have a uterine ablation before I had my hysterectomy, and this is what was going on. Always add that to the information. But, that's getting to know that patient. They, oh, I forgot to tell you that.
Yeah.
But at the end of that situation, then we send them to get the labs. And it usually takes 7 to 10 days to get those back. They're back in for another hour visit. And that's crucial. We spend an entire hour as needed. They may not have a whole lot going on.
Right.
But we offer them that entire hour to spend with us and go through things and get them started on their plan of care. And the way our EMR works, we've got it really set up nicely now. Darren and I both are putting the plan for the patient. They get that chart. They get their note. They get their lab orders. They get everything sent to them. That way, if they have a question, they can always open that chart right up and there's their information and reference it. And if they can't find what we talked about, they can shoot us a text. Hey, did we talk about this? Because maybe one of the two of us forgot to write that down. Oh, right. Yeah, we did. This is what we do. We add that to the note. But we want that patient to have a relationship with us, be trusting to know they can look at all their information that we share with them. That way, they feel like they're confident that they're going to get taken care of. They're going to be able to get their questions answered and so forth. So the first 2 visits are they're extended and
very in-depth.
Really in-depth, yes.
Yeah, and I can't really emphasize enough that if you've got a problem, get labs done before you start treating yourself, before you decide to go on testosterone, before you say, hey, my energy level's low, I'm a 35-year-old male, I'm going to start testosterone, and you get it off your buddy. You don't know what your base levels are like. You don't know if you have issues that could be highly contraindicated to taking testosterone. Like there's so many things. And testosterone, yes, it is a hormone. Yes, it's absolutely vital to our health, especially as males and females. And women. But the thing is, you don't know what your baselines are. And if you don't know what those are, you could do a lot of damage to yourself. And, we just don't do that. You come in saying, hey, I need testosterone this way.
You're not going to get it.
You're not going to get it. We're going to go through labs. We're going to go through your history. Now, absolutely, if your labs and, your symptoms match up and says, hey, this person needs testosterone, male or female, absolutely, we can do that. The other thing is, we see patients all the time who say, I don't really know if I want to go on testosterone yet. And there are lots of options for that. We can treat patients. You can use Clomid, right, to increase natural testosterone levels. You can use enclomiphene. Both of those have differences or variances of why or why not we may not utilize those. The other thing is HCG, human chorionic gonadotropin, is another issue is another item, peptide that can really be used to increase testosterone levels. So there's options without having to give yourself an injection or go on testosterone. Because, what we hear sometimes, my wife doesn't want me to be on steroids, right?
Right.
Testosterone replacement is not steroids, right?
Everyone has that impression that, they're going to get steroids like the gym guy, and it's like, this is a part of your health. This is your
It is like a medication,
and your mental health. You've got to have a good level of testosterone. So this has nothing to do with the gym buddy you're thinking of. And we even have some gentlemen. I have one gentleman in particular that didn't want anyone to know he was taking it. I would have to give him his injection for a year, and he would come to the gym where I open it occasionally through the week. And he would want me to be secretive about giving him the shot because he was so afraid that the other gym members would think he was just trying to be the big gym boy.
Yeah.
I'm like, this has nothing to do with that. It's your health.
Now, your gym bros and your gym rats that are on, they're on steroids, right? Because they don't know what they're doing. They don't know where their source is coming from, right?
They don't know the levels.
They're probably taking way more than therapeutic levels, physiologic levels. Their levels are way too high. Those are guys that are on steroids, right? But TRT for men or women is not steroids, right? It is absolutely not.
It's hormone replacement therapy.
It's hormone replacement. It's a medication just like anything else, just like if you're deficient in anything. But the one thing, it makes a massive impact in your life really pretty quickly. Within a couple of weeks, you can notice a difference, And we get guys, men and women both coming in. Really, I think... libido is a huge thing for women. I have one young patient. She's probably 28. And the reason why she came in was she felt really, really guilty because intimacy with her husband was a real struggle. Didn't want it, didn't enjoy it. She knew it wasn't something that, was just important to her, but she knew it was a mental thing, a physical thing. She hoped maybe it was her hormone level because she wanted that. And she said, and she felt terrible about how she felt about it because she loves her husband, but yet she just didn't enjoy intimacy whatsoever. And that was the main reason she came in, was to get her hormones to say, okay, listen, is this the issue? And it absolutely was. And so once we started treating her, once we did the labs, once we got her hormones balanced, and she did need to be on testosterone, night and day difference. She came back in, was literally almost probably 4 weeks later, almost in tears, saying that she can't believe for the last 6-7 years what she'd been missing out of her marriage and enjoying the intimacy now. And these are huge things,
crucial thing in your
for a marriage. Yeah, absolutely.
As we age and the hormones change, the hormone levels are changing, and that causes a problem there.
No, and she was young for that. But typically we'll see like 30 to 35 where that switch kicks in, and she was young. But it's absolutely vital for women too. And of course, guys come in all the time saying, man, I've got erectile issues, I'm just not seeing the response in the gym. But some of them just say, listen, I just want to be more me. Like, I want to be more effective in what I do. I can't focus. Like, I know I can be better.
I want to recover when I do an activity. If I lift weights, I don't want to be sore for 5 days. And that happens.
Right.
They're sore, I'm exaggerating maybe with 5 days, but they're having extended healing of the muscles because their testosterone is so low. They can't recover.
Yeah, absolutely. And so, the baseline labs are just absolutely crucial, because on the other end of that, we've had patients come in going, men particularly, going, I know I'm low in testosterone. I've got, I can't recover. I don't feel good. I don't have an energy level. Comes back, their testosterone levels are great. However, they may have extremely low iron, low ferritin. They could have low substrate hormone levels like DHEA. They're just low thyroid. We've seen guys coming in swearing they've got testosterone issue, and it's a thyroid problem. So, again, don't go by the bro science. Don't go by the gym rats. And whatever you do, don't just go get testosterone from somebody that you don't know what the source is and those types of things, because that is steroids, right? That is the misnomer. That is the thing out there that we're fighting against, is because that's the kind of thing that gives people the bad impression of testosterone replacement. So, seek out quality medical care with people that have experience, that know what they're doing. Unfortunately, that's typically not going to be your typical primary care, family general practice doctor.
Those guys do so much. They're doing a lot of things. They're trying to juggle a lot of plates, which
we
do
as well. A lot of sick people, yes.
A lot of sick people. And, these are things that when you're in the normal Richter scale, you're not going to be observed of having a problem.
Right.
And going back to what you said with the, don't just assume that fatigue causes that. That goes back to my early days as a nurse practitioner. There's a differential diagnosis for fatigue. It's diabetes, all kinds of things. And you've got to rule out which one is which, and not just treat one like it is the problem.
Simple dehydration can cause
absolutely.
it. Yeah.
You have to really know what's under there. And I just can't stress that enough. I think that what I see, and it's not just, I'm speaking out for him as well. You have someone who really want to be healthy, but they want that to happen like tomorrow. I mean, it doesn't happen tomorrow. Darren and I both have always been fit. I've been always watched my diet, my food. Anyone who knows me knows that my life has been about working out, running, being a gym rat, eating healthy. But, I've had my own issues with thyroid. I've had my own issues with hormone replacement. And I was having down times. Recently, I was exhausted. And I'm like, what is wrong with me? As my testosterone, I take bioidentical hormone. Is it not working? Do I need to change to an injection? Do I need to change my route of administration? I got my labs done, and my cortisol was through the roof. So that's why I was having symptoms. It wasn't
stress
that.
hormone.
If I would just would have changed my mind, and my actual hormones were a little bit elevated at that point in time, which makes no sense because I would never changed anything. But then when I got the cortisol down, everything normal back out. So I was just very stressed. So, these things can change. It's not something you get set on something that's always going to remain the same. You may have to be tweaked every so often because
life happens. Stress happens. Things change physiologically, that you may not utilize the hormone, whatever it is that we're giving you, the way that you were before. And so that can change. And that's why the monitoring process is just really so important in that aspect. I mean, myself, I've been on testosterone replacement since like 2015. Started at normal levels all through my life, felt great, no problems. Got Lyme's disease for the third time, avid bow hunter, outdoorsman. But after the third time, it really just kicked my rear. My testosterone levels dropped sub 100, which is is about as low. And I can't even begin to describe how bad I felt in regards to fatigue. And I'm like the Energizer Bunny, like run on nothing, no sleep, that kind of thing. And I'm talking about like if I went out and walked 100 yards, I was ready to die. Like it was terrible. And so I've been on testosterone replacement therapy. But again, it's testosterone replacement therapy. And I'll be the first to say, listen, I do not do she will tell you. I don't do super physiologic levels. No. I maintain, even being a pro bodybuilder, I do not do super physiologic levels because again, I can't preach to people like this, and this can really be bad for your health, and then turn around and do it myself. I can't do that, right? And so my levels, I monitor. I do the same things that I'm telling our patients that they need to do, but I am not on steroids, right? And, I've been on videos and people are going, oh, this guy's on steroids. And
they literally remarked that.
Oh, yeah. I mean, been bullish like trolls about it. But and I'll say, listen, no, I'm on TRT. Oh, you're on steroids. No, I'm on TRT. Like,
that's that
I'll show my labs to anybody anytime. Yeah. But, the important thing, I still monitor mine. Like, absolutely. I've been on the same dose forever, but still periodically I monitor my levels to say, okay, listen, I've had a life change, maybe a big diet change, maybe something going on medically.
I've seen you drop back down to your 100 level.
And it's been, and you feel terrible, but then you've got to figure, okay, what's going on, what's causing this. So again, even for myself, with my knowledge base, I monitor and do those things. So we both have dealt with these struggles ourselves. And so that's why we really, really are passionate about what we do, because we know how bad you can feel. I mean, you can feel really bad when something like your testosterone's off. When your vitamin D's off, you can feel absolutely terrible. And as a woman, I mean, if your estrogen and progesterone are out of balance, like, you can, anxiety issues, sleep issues, just not feeling good, right? Mentally not being in a good space. Again, having kind of lots of aches and pains as a female, a lot of times can be an estrogen progesterone imbalance. There's just so many things to talk about in regards to that. But the biggest point of that is get labs done to see what your baselines are and find a provider that knows how to manage you as you are as a patient with your complaints, combined with what your labs look like.
I'm going to advise you here, not just because, basically we use your insurance labs most of the time.
Yes.
Because we are a cash pay visit practice because we're functional medicine. But everything we order, as far as diagnostic testing, as far as labs, we give you that order to bill your insurance.
Right.
And we even give you a receipt from our office to use to bill your insurance if you'd like. Don't go to someone who's just going to bill you and get your labs for you and can't help you.
Right.
Because why do you want to pay someone money to get your labs, cash price, and then they can't treat you? They have to send you somewhere else.
Or they treat you. We see this with trainers all the time. They treat you with steroids. Yeah. Again, it's steroids they get from somebody else, right? Because this isn't medically monitored. They're not a medical professional, right? And so that does put you in that class of steroids. That is not testosterone replacement.
I don't know how they are able to do that legally. Yes. There obviously is a medical director somewhere in the pipeline, but they're not reviewing that lab work. That person's be reviewing that, and they really don't. We get them sometimes, and they didn't know how to treat it. So, hey, will you see this patient? Just don't do that, because then they don't have all the labs we need.
And we've got to run them anyway. Yeah.
And now we do offer cash labs. We can do that when you have like a high deductible insurance.
Yes,
and
absolutely.
We can get it for less for you, but if we can help you get your care paid for, we're going to go that route every daggone time.
Anything we can do to reduce your expenses,
absolutely.
We're going to try to do it, yes.
We're in this because we are passionate about it.
Yes.
And that's obvious. Anyone who's ever seen us knows that as being the answer, the reason we're here. I've never felt more fulfilled in a job or any of my areas of nursing, nurse practice, as I do now, because I really feel like we're changing people, we're helping people, and it's changing their lives. And that may sound hokey, that may sound corny, but that's absolutely the truth.
And the great thing too is, there's no patient is the same. And when we do it the way we do it, we don't have cookie cutter things. We don't have specific protocols. Like every patient coming in is a puzzle. And it's great as a practitioner to sit there and go, okay, what's really going on with this patient? Because, unfortunately, patients are allowed to have 2, 3, 4, 5, 6 things wrong with them, right?
We find it all at one time.
And we find all of them at one time. So then it's prioritizing, okay, listen, what's the main issue here that we've got to address? So it's a great way to practice. I love what we do. Like, there's never really a day I come in and go, man, this is work.
No, it doesn't feel like work.
Because we really enjoy it. Now, are there days that we get tired? We're normal people, right? Right. The charting and EMR. I hate the EMR
but it's
part.
Like, but that we want that record there so you can see what's going on.
Yes.
Plus, we can reflect back, and if you give us a call 6 months from your last visit, oh my gosh, they haven't been here for 6 months, but this is what was going on last time we got it right there.
Yeah.
And if we're really fine tuning on our documentation. We have all that, and
Yeah.
you can see it too. So it can be frustrating. That's the most frustrating part about my job ever in the last how many years now?
Yeah. And, you know,
55
and
years.
consistently, that's the other thing. When people come in, I mean, we look at, diets nowadays, which we were talking about earlier, are just garbage. I mean, you know, a lot of people eat so much fast food, which is more chemical food than actual food. You know, they're not drinking enough water. They're eating too much fat. They're eating way too much sugar. They're eating out of boxes. They're eating out of prepackaged meals. I mean, society now is not meant for you to be healthy. I mean, you look at a beach picture from the 1950s.
Oh my gosh, yeah.
And there are no overweight people.
No, there's not.
There is no one on that beach that's overweight. And you look at a beach picture now, and 90% of the people are overweight, which is why dad bods have come into, hey man, got a dad bod. I'm hot. Right? No, time out. Like, come on. Like, you know, and so that's the thing. When you look, and it's an absolutely fundamental shift in society, going from how the food is prepared, how we eat it, how it's shipped, and, you know, eating something that can stay on the shelves for 3, 4, 5, 6 weeks can't be healthy. No, and so I mean that's one of those things. We sit down, every patient we look at their diet, and there's very few patients that we don't modify the diet, right?
Absolutely.
And really go towards real food, and really just really emphasize. Listen, you've got to eat real food. You need to make it. You need to prep it. Don't buy the box things. Don't eat out. You know, McDonald's French fries. They used to be super healthy. They were potato and lard, right?
That's it.
And now they're not probably even real potatoes. They're genetically modified potatoes. It's a chemical in there for some type of oil mixture or whatever. But, you know, it has completely changed. I mean, fast food used to actually be healthy food. It used to be all beef, you know, the things that it's not anymore. So, you know, diet is massive.
And we try to go. We don't. That's not a cookie cutter situation either. You know,
it's not.
You have, especially with women. Sometimes a 16 fast and 8 hour eating window is better for a woman in menopause. You know, maybe she needs to have good fats higher than her protein for a while to get the weight off, and then flip that with more protein, but keep a lower carb. And that's one thing that we do. Like, Darren usually gives them macros to start with, and then if that doesn't work, we make a change. There's no cookie cutter. Again, we've said that 15 times, I'm sure, on this broadcast. But basically, it doesn't mean you're going to always be that way. It changes all the time to get you where you want.
Well, it changes by your stress. I mean, you know, who's not stressed anymore? I mean, like, really, who isn't?
Not
me.
Yeah.
In our society, who is not stressed? If you work, you're stressed. I mean, we're on deadlines, we're on everything, right? It's always something. I mean, everybody has stress. So you can either complain about it or you can do something about it. You can get the exercise, you can modify your diet. There's a lot of things you can do naturally to take care of your health and take control.
That's what we try to get you to do. You know, It's like, this is what is important to get healthy. You can do everything we say, but if you don't get off the couch and you don't walk and you don't eat clean,
don't quit drinking pop 3 times a day.
3 times a day. I mean, alcohol, there's nothing wrong with alcohol in moderation. If you drink alcohol every single day,
it's going to impact your health.
It's going to impact your health. I've got friends that will not come to see us, and they'll spend money on, I get my nails done, I get my hair done, but I'll send it on their eyebrows, their eyelashes, their Botox, their nails, their toes, everything, and they'll try to buy the biggest, fastest pill to help them lose weight.
Yes.
They don't want to change their diet habits. They don't want to increase their exercise. I mean, this is old-fashioned health. To be healthy, you have to, and it's not about calories in and calories out.
These are smart, astute people, good business people,
intelligent people.
They're not doing anything for their health. Yeah.
They don't want to come to us and pay us a bill when they can include that on their insurance payment. They can send it to them because it's a different setup sometimes. But I think there's a fear that among some people that it's the unknown. What are they? What do you mean?
A lot of people just don't want to know. Yeah,
they don't understand what we do. But then when they get there, those that come, like I have one this morning. She's like, "I'm the first person." She's a nurse. I came, and everybody's waiting to see what my impression is, and they're going to come and see you after you. I feel better, and she's already sent us today. She made a review as soon as she left the office. Put a review on Google. I mean, it's like I said, it's not a job to us. I mean, I don't care how many people come to see us. I'm here to help you. So if you want to come and get help, and you want to get in shape and I mean physically or optimizing your entire health overall, then this is the place to come.
Yeah, I mean, we're functional medicine, but, you know, we were just having this discussion. I mean, we're really family practice.
We still do,
because we see so many patients with cardiac issues, with diabetic, blood sugar, you know, glucose control issues.
That's huge.
Absolutely huge because of our diets now. And so, we see that. We see other issues with circulatory problems, metabolic disorders, which are a whole nother conversation, right? Again, a lot of based on food, stress, these types of things. But, so it's really kind of we're functional medicine, but I mean, it's still, because really whatever we find on your labs compared to with what you're complaining, we're going to address that, because that's the only way we can practice. We're not, there's a lot of these fly by night. I don't, some of them have been around a long time. They're hormone replacements. You get basic labs, and then here's your testosterone, right? They're not checking they're not checking any cardiac risk factors. They're not checking on what your lipid levels are. Or once you start on, say, when you start on hormonal replacement, some patients can have a negative affect for their lipids. Yes. It can increase lipids, and then we've got to look at other options for them. These other places aren't doing that, right? And so they're on these testosterone replacement, I'm almost saying it's really like steroids, because nobody's really monitoring at that point what their levels are, those types that they do blood work one time, then they say, here's your hormones.
6 or 8 minutes later, they have monitored what you're doing.
Yeah, and they have no clue. And you could be in some major health risks, because of that testosterone. Again, testosterone is an absolute wonderful medication, right? Any hormone is. But just like anything else, it can cause in the appropriate dosage, and even inappropriate dosage, some patients don't respond well to it, right? And there can be a negative adverse effect with it. And again, that's why we monitor. And that's why we can't really just really accentuate the fact that you've got to really be in a practice, again, that's monitoring, that's checking on your overall level of health, how you're responding to the hormones, or any type of medication, whether it's iron, whether it's B vitamins, right? Anything, whatever it is that you need to be checked. Now, once we've got a patient that has their lab values very steady over, let's say, a 3-4 month window, then we know they're pretty in a good shape for a long time.
Right, and we're going to decrease the visits.
Yeah, we're going to decrease the visits, and and so they're going to go longer without having to see us, without the labs, and because we know that they're stable really at that point. But it takes a while to get there for some patients, and so that's the other thing. So be very wary of a lot of these online places where you get labs one time. Right, you get medication, you're just paying for a refill on medication, but then they're not really following
up with you.
And how do they even know at that point, let's say after 4 to 6 weeks, how do they even know your levels are at therapeutic level if they're not doing labs again? You may not be taking enough testosterone, you may be taking too much. And so, these are the kind of things you need to be wary of on these outside sources versus somebody that's constantly monitoring and watching, because again, there is a slippery slope when you can go from testosterone replacement, hormonal replacement, to steroids and just taking meds that really aren't being monitored.
And he's mentioned this in other broadcasts as well, but when you look at a younger client, a younger male especially, if you just let someone put you on testosterone, you may never be able to produce your own testosterone again.
Yep, and one dose can affect you for the entire life.
And you need to, we think about all that. We look at your diet, what you're taking. You may just have to increase your fat in your diet. You're not getting enough. Or try the other supplements that we talked about earlier to get your levels up before you go to an injection. Because once you hit
somebody
that
under
mark,
35 is going to have a hard time getting us to put them on testosterone, really. I mean, honestly, because, especially someone sub 30 for sure. Because, once you start on that testosterone, there's a chance that you could shut off your natural and endogenous levels forever. It happens. It's not all the time, and a lot of times, can you take a post-cycle therapy, those types like you hear in the bodybuilder world? And yes, you can. And can it normalize? Yes. But there are some patients, one single dose of testosterone can shut down your own production forever. And then you're stuck taking a shot the rest of your life. And so, especially when there's other ways, and, we see that under 35 category a lot. We see diet as a massive issue. Not enough good fats, not enough good proteins, obesity, right? If your body fat's elevated, your testosterone is going to be low. I mean, it's just almost guaranteed, right? If you're not exercising, if you're not sleeping. So we can look at these in that age group and, okay, listen, where can we modify this? What other supplements can we do? Can we do peptides? Can we do something to help produce natural levels of testosterone? And that's what we're going to really do. Again, that's the difference in us and a lot of other practices in regards to that functional medicine. No real strict protocol for any one patient, and we treat every patient individually. Big deal. Yeah. And so, you guys have got to really take that into consideration.
Health optimization. Just think of it as that way. That is what our goal is for you, is to optimize your health. No matter what that number says, it's how you feel. And we are going to monitor the labs and try not to go any further with testing. But the point is, it's about how you feel. We're going to measure our decisions according to that.
Absolutely. And a lot of other patients that we get coming in, some that we see a good bit, like, I just can't lose weight, right? Well, and again, they can't lose weight we see it all the time, especially with women. They're eating once a day, 400 calories, and their metabolism is completely shut off. But they're coming in going, hey, my thyroid's off, I can't lose weight. Or I'm overweight, I'm obese because my thyroid's off, right? And they just have been told that. And it has nothing to do with their thyroid. It literally is their diet, right? And so there's other things that we look at in regards to that. But that's another patient set we see coming in all the time, like, I just can't lose weight. Could it be a hormonal imbalance? Absolutely. You know, for females, progesterone being very low, a couple things that can do. Keep you from losing weight, can cause infertility or a lot of miscarriages, or actually because of low progesterone levels. See that all the time. And if you look at the research now, probably going back for years, they're really starting to think, okay, somebody that's consistently miscarrying, it's low progesterone.
And it's
right?
very sad because we have a lot of people that have never been able to carry a baby.
Yes.
And we find those levels that are very low, and you think that's had to have been that way all this time. And they may have been able to be, if they would have been placed on some replacement, would they have been able to carry it?
If they had a doctor that knew what they were looking for. Yeah, it's a difficult thing. And so, and we've had patients too come in, hormones completely out of whack. We've had a husband and wife came in, hormones completely out of whack, had been struggling. They had 3 kids. Struggled to have those 3 kids. We got their hormones balanced. We didn't see them for a while, and all of a sudden we see on Facebook they had a baby. So you know, that's I wouldn't say that's the downside, but you know,
it didn't happen to everybody, but it did.
Yeah, and I've seen him a couple times. He's like, dude, like, man, you did it to us. I was like, that, you know, it's not my fault, you know. So there's other things that make that happen, not us just making your hormones balance. But that absolutely is absolutely true story, though. I mean, they both were a train wreck hormonally. 3 kids, struggled to get those 3 kids. That even had to think about IVF and those types of things. And all of a sudden, get the hormones balanced and she's pregnant. And we're like, wow, you know, okay. So, you know, we have to make that disclaimer from now on. Say, listen, if you don't want kids and we do this,
make sure you take precautions.
Be careful, yeah. And so, you know, those are the kind of things that we see that we love doing, you know, and again, that just shows how important hormonal balancing is to your overall level of health. It can, have an effect on every single aspect of your life. So, and just even nutritional issues. I mean, we see that, you know, we see so many nutritional deficiencies.
Such a high.
Yeah.
That's so common.
Yeah.
Unless and so, you're just in a field where you're like, you know, either you're a gym rat or you're into fitness, you automatically think, and you have some fitness people that eat terrible. Now, don't get me wrong. I mean, we do. We see that. If we fix that, that improves their overall health.
Absolutely,
as well,
yeah. So there's a lot of things really that goes into the real practice of functional medicine. But, you know, again, you know, it's one of those things that, you know, if you come in to see us, and we've seen this before, you've got issues with hormones. They'll say, hey, listen, I need to talk to my spouse. We'll say, listen, have the spouse come in, you know, and make that explanation like, listen, this is not steroids. This is medically supervised treatment, right? And there's a big difference with that. So, you know, in any aspect of your life, if you are struggling, if you can't lose weight, if you don't feel good, right? You just don't feel like, or you know what, you just feel like, hey, listen, I can be more. I can be a better dad. I can have energy. I could, you know, those are the kind of things where, you know, you're lacking in any aspect of your life, come see us. Because if you're lacking in something, there's something off, right? And that's our job to find out what that is and help you manage that and get back to being a whole lot better you, you know, optimizing you for who you are. You know, we're not trying to make anybody into a bodybuilder, right? We're not trying to make anybody into a physique athlete, right? That's not what we do. We're just trying to help you be a better version of you to whatever version that you want to be, right? And so, you know, that is, again, not what testosterone replacement is. It is not making people bodybuilders. It is not making them gym rats. It's not, you know, and speaking to that, really, if you're a female and like, unless you're like really on super physiologic, you are never going to look thick and dense, and right. Females can lift weights. Females can go to the gym, and you're not going to get muscly. You're not, you know, you'll add some muscle, but you're not going to look like these figure contestants and these bodybuilding contestants.
Those people online are using steroids.
They're using steroids, you know,
and other things.
Yeah, and other things. And so, you know, lifting weights as a female is not going to do anything but have a positive benefit to your life, right?
Decreasing osteoporosis.
Oh, massive, yes.
And people are, I don't want to lift weights. I bulk up too much.
I bulk up too much. You don't, yeah. And so, you know, if you bulk up too, it's probably because your diet's off, right? Or some other things. But, you know, females lifting weights, absolutely healthy for you. Muscle mass is absolutely a decrease in all-cause mortality. When you look at the more muscle mass you have, typically within normal parameters, the healthier you're going to be for a prolonged period in your life, period. That's just the way it is, right? And so, don't have that mindset of, listen, if I go on testosterone replacement as a female, I'm going to get bulky with all these muscles. You're
getting
not.
such a small, minute dose. We're not giving you that.
Yeah, you're not going to be a body. And that combined with weightlifting, as we prescribe for you to do, and resistance training, you're not going to look like that. It's just not going to happen as a female. Yes, some females may have an aptitude for being able to put a little more muscle on. You're still never going to look like a bodybuilder, competitive female athlete. It's not going to happen. You're just
mentioning that you have natural athletes and you have those that are on.
Yes,
a natural athlete. If you see online, you follow those people. They are tested. If they win a competition, they cannot have steroids on board.
Right.
So
they look completely different.
That natural athlete,
and these are people that
hard.
Their diet is perfect.
Their diet is perfect,
and they're in the gym all the time. And you look at those females; they're not. Like no, there's not even comparable to. So don't think that has anything to do with what you will look like as a female if you're on testosterone replacement, or we say, hey, listen, you really need to start with some resistance training. You need to exercise. It's only going to make you healthier. It's only going to make you feel better. And yeah, absolutely, you're going to look better naked in the mirror, and you're going to like that. And whoever you're dating or married to is probably going to like it too. But it's not going to make you look like a bodybuilder or a physique athlete or anything like that by any means. It's just going to make you healthier. So again, we get these conversations with spouses and other things coming in going, hey, I don't want her to look like this or whatever. That's fine. That's okay. But if you've got questions, come in, ask us, and again, don't go by, the bro science, the gym science. Don't go by, what you see on TV, what you hear. Science has changed so much in hormonal replacement therapy over the last 30 years. I mean, 5 years ago, we still thought that estrogen caused breast cancer. And if that was the case, every 25-year-old woman that has good estrogen levels would have breast cancer. I mean, when you go back and look at the studies, when you look at the meta-analysis now, estrogen has so little to do with breast cancer that it's not even something we really worry about. Now, if you've had breast cancer,
if you have that genetic,
and the genetic BRC1 or BRCA2, different ballgame, right?
That's different.
Where estrogen is the cause of it, but that's such a minority that it's just something. But again, that's just how much science and the research has changed. I mean, it is constantly developing. I mean, changing, evolving. I mean, all the time now, almost on a monthly, weekly basis. As we're really, the NIH and people are really starting to put money into studying this long term and seeing what the effects of hormonal replacement are and the quality of life, and then all-cause decrease in all-cause mortality, life expanse. I mean, all of these other things, and it's massive. And how you feel, how your outlook, everything.
I'm going to give a book a plug today. Good Energy, and Casey Means, I think it's Casey. There's a brother and sister. I think it's Casey. I don't have it brought up on my phone right now, but talks about she was basically a fifth-year ear, nose, and throat resident who was basically, pristine. She had got all the awards, was top resident all the way through med school. Was going to go into an extra little sub-acute area of medicine. But she took care of a lady that had a sinus surgery. And she said, when she woke up to me, she said, thank you so much for fixing me. And she said, I walked away knowing that I didn't fix that woman. No one ever told me how to fix a problem. They only told me how to prevent it or try to help the person not get to that. They only told me how to fix it with a surgery or a medicine. And she said, I literally couldn't get it off my mind. And I walked in and put my pager on the desk and said, I'm done. And this woman was a Stanford graduate.
Smart lady,
for class. You got to read a book. I'm just talking
lady.
About basically the food we eat. And actually her brother's on Capitol Hill right now going through trying to get some legislative changes. It's extremely important. The diet that we eat, they're really pushing that. And I'm loving that every minute.
Well, and in regards to that, I do a mentoring group and some training with guys all around the world. It's crazy when you talk to these guys in Australia and Europe.
They don't have this food.
They don't have the food that we have. And when you show them the versions, their version of the food that we have, like the same brand, same everything, it's completely different. The ingredients are different. In Australia, there is a section where it's basically U.S. food, and it has warning labels on it, right? Mm-hmm. And it's crazy. And we're so far behind other countries in really what we look. And again, that comes down to lobbying. That comes down to money, right? There is a lot of money in the food industry, massive amount of money in the food industry. And so, these are things that you have to be aware of because, you got to start reading labels. You got to think about this. Our society is not designed to help keep you healthy.
It is not.
in any manner
Just-
whatsoever.
Just again, like I said, what was it? What was in ice cream or cookies 50 years ago is not what's in ice cream.
Milk and real sugar, and that was it. Yeah, yeah, and it's completely changed.
And we don't read those labels. We just buy what we buy.
Yeah.
And we've all been guilty of eating the wrong food. I mean, I love Cheetos. It's a rarity that I eat them because I know they're horrible. They're actually
chemical death puffs. so, yes.
So if I see them, my husband bought them. Nope, I'm not having Cheetos.
Yeah.
I'm not having them.
So, that's kind of a little bit about our practice, our background. Again, just kind of a quick discussion today about overall levels of health and what you can do and be proactive. So, from going forward, really sit down and look at your diet, look at your exercise, look at your sleep, right? Look at how you feel, right? And if you don't feel good, right, don't listen to your doctor if they just say, listen, that's normal because of your age.
You're getting older.
Right, you're getting older. Or, hey, your labs are good, it's okay, you're stressed, right? No. You absolutely have the right to feel good, right? And that's when you need to call somebody like our practice at Ascend Elite Health, Total Health Pros, and say, listen, that's all you have to start out with. I just don't feel good.
I just don't feel good.
I want to come in and see you. That's all you have to tell us, right? When you come in, we'll figure out what's going on. We don't really need any more information than that till we see you. I just don't feel good. I want to feel better. And that's what we love to do. That's what we love to do. So you can reach us easily, 304-382-2080. 681-781-9005.
Right.
Yeah, Instagram, we're at Total Health Pros. On Facebook, we're Ascend Elite Health. We're on YouTube now. You can get hold of us anyway, and so we're at 206 Chase Park in Hurricane. But give us a call. If it's something, hey, I just don't even know if it's applicable to me, definitely give us a call. And
your call's not going to be a charge.
Yeah, it's not going to be a charge. We'll do a little consult with you and say, listen, we can help you. Or we'll say, listen, probably not something within the scope that we're going to be able to help you with, but here's somebody we can refer you to, right? And we do that on a pretty regular basis. And so, do that. We want to try to help you. This is a team, right? It's us and you as a patient, and that's how we look at it. We love what we do. So, if you get a chance, if you've got questions like that, absolutely reach out, give us a call.
We'd love to hear from you. That's
Yep.
You said it all, Barry.
Absolutely, guys. So thank you so much again for your time, for watching this. Do us a favor. Again, go to Facebook, Instagram, like and share. It will help us a lot. Our website, totalhealthpros.com. Please visit there.
Please visit.
That's huge for us in helping us get our word out about what we do. So, anything you can do to help us out, we greatly appreciate it. But, the most important thing is, if you're struggling, give us a call. We'll be there for you. We really appreciate it, guys.
Thanks so much.
Yep, we'll see you.